cervical spine stuff now. So Danielle mentioned that you're having some difficulty like doing this sort of lateral glide stuff. First, sensory stuff is always going to help you. So always just grab like a cloth or like a shirt. So I got a shirt. Take the shirt and just rub your neck as to where this movement's going to happen, right? So it's going to happen from your vertebrae. So I'm rubbing the back of my neck, or put vibration on there, or cold pack, hot pack, whatever. Feel before we can move. So if you can't feel it, chances are the movement's going to be really crappy. So now that I've done some sensory work, now you can sort of try to do the movement. And I don't do this one very often, but you can see the job isn't to like do this well. It's the intent to hit your end range of motion. So for me, like when I do this, my body's not going to change because this is whatever, I can do that. What's going to make me change pain wise everywhere in my body is me pushing myself to my edge. So when I crank this way, I can't get any further that way. So that's where I want to work in. So as I'm doing the circle, you'll see it's a lot choppier, and I'm a little bit more tense because I'm in an uncomfortable zone. So you might be in an uncomfortable zone pretty quickly, like, that's my edge. That's perfectly fine. That's what you want to work in. So your circle might just be something super small like that, and that's perfectly okay. Just be in your sort of uncomfortable zone. Breathe, make it easy. Something that might help this is good pelvic mobility. For some reason, mobility here really helps mobility up in the upper neck. So you want to try to do like a weird, like a little hula dance almost. It's very subtle. Might not look that subtle, but you're trying to move just your pelvic bowl. And you're not doing like an exaggerated one where your lumbar spine's getting into it. You see how that's like very big. Just visualize the pelvic bowl sort of doing a little tilt. You're trying to keep your spine relatively straight. Try different ranges of motion. As this improves, this will get better. As this gets better, this will get better. So you want to go back and forth.